This is Dr. Vinay Samuel Gaikwad, Director of Surgical Oncology at Birla Hospital in Gurgaon. And in this video, I want to discuss whether HIPEC, that is HIPEC, Hyperthermic Intraperitoneal Chemotherapy, is effective in all patients with advanced abdominal cancers. So the question is, can we implement this procedure HIPEC in all patients with cancer that is spread within the abdominal cavity or peritoneal cavity? So the simple answer to this obviously is no. There are many factors that have to be considered before a patient is offered cytoreductive surgery and HIPEC. So what are these factors? I think the number one factor would be what is called tumor biology, which is very difficult to assess. It takes time, it takes an understanding of something we don't have. So tumor biology is the king in these patient selections, but sometimes we cannot really understand the tumor biology before we decide to go ahead with this procedure. The other thing is certain abdominal cancers like stomach cancer, ovarian cancer, colorectal cancers, appendicular tumors. These are relatively better procedures in which peritoneal carcinomatosis can be addressed through CRS and HIPEC. Other cancers such as pancreatic cancers, liver cancers, and gall bladder cancers, when they spread into the abdominal cavity, it is usually not amenable to CRS and HIPEC because it does not benefit the patient very much. The other thing we calculate is a PCI, or a peritoneal carcinomatosis index. Depending on the cancer type and the score, the PCI score that we calculate, a patient might or might not be a candidate for the HIPEC procedure. Another thing is a primary organ that is starting the malignancy, such as whether it's the appendix, the stomach, the colon, and so on. Based on these primaries, the PCI cutoff can be decided in certain situations. Also, whether it's the primary tumor, the first time this cancer is being spread in the abdomen, or is it the second or recurrent or third time. All these factors are very important when we're deciding the patient fitness, whether the general condition of the patient can tolerate such a super major procedure. So these are some of the factors. There are also certain molecular markers that can be done, which when we get the results, we can decide whether the CRS and HIPEC procedure is going to really benefit them in the long term or not. So all these factors put together, your surgical oncologist or HIPEC specialist will look into all these factors before suggesting finally whether a patient will or will not benefit from CRS and HIPEC. I hope this information has been helpful.